A survey taken during the pandemic found 62% of intensive care unit nurses are burned out. Now we're seeing a long-term impact. Senior medical correspondent Dr. Tara Narula spoke to ICU nurses who left their frontline jobs or dropped out of the profession.
For 7 years, Paulette Rangel worked overnights as an ICU nurse in Phoenix. When COVID came calling last year, Rangel and her co-workers stepped up.
Some nurses were working 4, 5, 6 days a week, 12-hour shifts.
Rangel says her training gave her the skills to respond to a pandemic, but did not prepare her for the emotional toll.
It takes a lot out of you. We wanted to be there for our patients, but when we're running on fumes, it's hard to do that.
Back home after her shifts, Rangel's distress was obvious.
I would go straight to my room. Talking to my husband, I was just telling him, I really don't want to get you guys sick.
After trying counseling and antidepressants, Rangel switched to a job in community health, seeing healthier patients during daytime hours.
The problems that we see in nursing now are not new. It's that high level that we had before COVID that's made it just really out of hand now.
Linda Aiken teaches and studies nursing at the University of Pennsylvania.
We have a robust supply of nurses. The problem is that we don't have enough funded, permanent, full-time positions for nurses in the settings where they're needed, namely hospitals, nursing homes, and schools.
There are no federal limits on patient-to-nurse ratios. California is the only state that has set minimum staffing standards. Aiken says the workload varies widely, with nurses in some hospitals caring for as many as 10 patients. In the early months of the pandemic, Christopher Hayes hit the road as a travel nurse.
What is it that really wore you down the most during the pandemic?
Getting used to the amount of people that were dying from COVID, and then talking to their family members after they died.
As Hayes rotated through 4 hospitals in Texas and Oklahoma, he saw a pattern.
People just still honestly do not understand how severe this is, how bad staffing for nursing is.
Hayes is now taking a break from nursing to recharge. He opened a CBD store, hoping to heal people in a different way. Dr. Tara Narula, CBS News, New York.
Research shows every patient added to a nurse's workload is associated with a 7% increase in the odds a patient will die just after common surgical procedures. A new study suggests gas gauges may not be as accurate as they should be. Details are next. Stay with us.